Thank you, Chairwoman Eshun. Appreciate you. And I know you asked earlier about my son, except the irony of that is I was actually doing a telehealth with with a neurologist. And so while you asked me, I was actually on the phone with on the telehealth with a neurologist speaking, because, my son's had traumatic brain injury. And I'll say this real quick. My son's doing great. But his specialist, we meet through Telehealth. There's several specialists that we haven't even had an in-person meeting with, because he's case study number one for accidents for pediatric neurology care and what he's going through. He's actually experimental. And so UCLA, I'm sorry, has taken on his case. Then there's a specialist out of Beverly Hills that's overseeing it. And then we have another specialist in Illinois, while we're in Oklahoma, rural Oklahoma. Telemedicine and telehealth is something that has opened up an opportunity for all of us, no matter where we live, to have those specialties come into our home, come into our communities, and allow us to have the same adequate care as we would if we were living in California, or we're living in Houston, or we're living in Chicago, or Washington, D.C. And why the pandemic has been horrific, it has also advanced the technology that we knew was here, but we wasn't, as Congress, we wasn't ready to look at it. We wasn't ready to embrace it, because we didn't know how to reimburse doctors. We didn't understand how to regulate it. We didn't understand how the doctor visits would work. But because of technology, we're here. And I have a good friend of mine that's an orthopedic surgeon that he does surgeries robotic. And while he has to be in the same room, he actually never has to lay his hands on the patient other than to comfort the patient. But he stands 3 foot away and replaces hips, or does surgery on the shoulder, or does surgeries on the knee. And by the way, he came to us through our Army, because he was in the service and performed surgeries even at Walter Reed. And our government is the one that taught him this technology, and it's capable now for us to bring home to our rural hospitals, where it's hard for us to get specialists to be there. And so the technology exists, but a lot of people, they don't even know how to embrace it yet. And so that's and by the way, my family has been the recipient of this. I mean, it's this whole year, because of the dramatic brain injury that my son had. We've embraced this. And I will tell you personally, at first, I didn't know if I liked it or not. I'm a very in-person, I like to be in person. But once I started it, I realized that I became the physician assistant. I became the PA, which was positive, because as a caregiver for my son, all of a sudden I'm interacting with the doctor. I'm putting my hands on my son, or we're having the conversation. We're having a conversation about costs, really, because when they send over the prescription, they send it to me, instead of me just being on my phone checking my emails, waiting for the doctor to schedule the next surgery, or schedule the imaging or lab work. I'm having to interact, and so it made me more cognitive of the care that my son was getting. But it also made me more cognitive of the cost, which is a good thing. There's nothing wrong with that. I've actually embraced it fully, where I enjoy them now. And I know I went long on explaining it, but I want to understand that I'm living this life, and it's beneficial. It's beneficial for us in rural parts of America, because we have the same access to the care that those in major metropolitan areas. With that, real quick, Dr. Resnick, I have a couple questions, because rural providers in my area are having a hard time actually understanding even how to gain access to telehealth grants. Do you feel like there's more that can be done to provide this information to the providers?
I know the AMA and specialty societies have just in the last several months rolled out a lot of additional information about some of the grants to help with implementation. CMS has actually been very cooperative and supportive in terms over the last year, in terms of helping us when we've needed to reach out to improve that process. But definitely put your colleagues in touch with me, and happy to see what we can do to help.
Do you think it'd be helpful to maybe have a one-stop shop for funding opportunities for telehealth?
I don't see any harm in that, and could be helpful.
Okay, maybe we can work with you on doing something like that too. And my office has been working on a bill with Chairman Eshun's office to ensure federal government creates a national telehealth strategy that streamlines and coordinates these things. Would it be beneficial for maybe there to be an elevated presence within HHS to coordinate these telehealth investments and policies across our government?
We'd love to talk more with you about that. I mean, I think our observation again has been that CMS has actually made this a big priority and been incredibly responsive to physicians and patients during the pandemic around this, and we're optimistic that responsiveness will continue. But this is a really important issue, and we do need to continue to have a national strategy. So let's follow up and talk more about what we can do.
Absolutely, because this is a great opportunity for rural America to have adequate and quality health care like all others. And I think this is a great starting point.
I'm so glad to hear your son is doing better. And I know this has been a really hard year for you and your family.
It has, but we've been very blessed. The Lord's been good to us. Thank you. I yield back.